Curious what devices and methods are used in limb lengthening? Let's find out. Let's start with Precice, the most advanced limb lengthening technology today. The system uses a magnetically controlled intramedullary nail that's made of titanium alloy. Inside the nail, there is a magnetic motor that is controlled by a handheld external remote controller, or the ERC. Based on the daily length prescribed by the doctor, the ERC is set to the desired length, then placed on the leg. When turned on, the ERC rotates the magnetic motor within the nail, which extends it in a linear position. This stretches apart the two bone ends, which precisely lengthens the bone in tiny increments. In the first procedure, the bone is cut and the Precice nail is inserted. About 2 years later, once the desired length is reached and the bone is fully healed, the second surgery removes the intramedullary nail. The lengthening process consists of 2 phases, lengthening and consolidation. The lengthening phase typically lasts 2 to 3 months, depending on the desired length. On average, given a 6 cm lengthening, from the surgery date, the consolidation phase lasts around 4 months for the femur and 7 months for the tibia. During this period, no lengthening occurs. It is essentially the healing period for the bone that allows it to harden and consolidate. Around 1.5 to 2 years after the first surgery, when the bone is remodeled and recovered to its original solidity, the second surgery removes the intramedullary nail. With the Precice nail, weight bearing is restricted. On average, given a 6 cm lengthening, patients can start walking without crutches from around 4 months for the femur and 7 months for the tibia from the surgery date. The exact recovery time is different for everyone, as it depends on various factors such as one's rehab progress, how fast the bone regenerates, and more. This is why a structured and comprehensive rehabilitation system is crucial to get the best results. Proper rehab not only enhances functional recovery but also helps prevent complications, making it an essential consideration. The LON, or lengthening over nail, is essentially a hybrid system. This method uses an external fixator to lengthen and an intramedullary nail to stabilize the bone. On the Elizarov frame are 2 sets of bolts that lengthen the frame upward or downward. This frame uses a wrench to manually rotate the bolts, which lengthens the frame, thus the bone. Each 45-degree rotation lengthens by 0.25 millimeters. The first surgery cuts the bone, inserts the intramedullary nail, and attaches the external frame. Then, around 3 to 5 months later, when the desired length is reached, the second surgery removes the external frame. Interlocking screws are inserted to fixate the length. Then, around 2 to 3 years later, when the bone is completely healed, the internal nail is removed. For the LON method as well, the lengthening process consists of 2 phases, lengthening and consolidation. The lengthening phase typically lasts 3 to 5 months, depending on the desired length. A couple weeks after the lengthening phase comes to an end, the external frame is removed and interlocking screws are inserted. Then is the consolidation phase. Again, it is the period where the bone hardens and consolidates. Around 2 to 3 years after the first surgery, and the bone is healed and recovered to its original solidity, the third surgery finally removes the internal nail. With the LON method, weight bearing is possible, allowing patients some mobility. Again, recovery time varies by person, but on average, given a 6 cm lengthening, patients are able to walk without crutches around 6 to 7 months from the surgery date. So, how do these methods compare? For the femur, Precice is incomparably better in all aspects except for price. But to compare, for a tibia lengthening, Precice has minimal scarring, while LON leaves more noticeable marks due to the pin sites of the external frame. Precice is much less painful overall, and LON's external fixator can cause intense pain. Theoretically, Precice has a lower risk thanks to its internal-only system, while LON carries a higher risk with its external pin going through everything from the skin to the bone. Deep infections are not a major concern at our hospital. However, superficial infections at the pin sites are common, and they can also have a negative impact on scarring. With LON, patients can stand throughout the entire treatment period, whereas with Precice, they need to use a wheelchair for an average of 7 months. Precice is significantly more expensive than LON. With LON, alignment is more controllable. All these factors are to be considered when making a decision about which method to lengthen the limbs. It depends on which factors are of the patient's priority.